Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What are the challenges of being a primary care physician in today's day and age? Find out more right now. My guest this evening is Dr. Mahmoud Doski, a well-regarded physician in the Maryland area. Mahmoud, welcome to Housecall.
Thank you very much, Dr. Doman, for having me today in your show.
Oh, and please call me Dave, okay?
Thank you.
All right. Now, tell our viewers briefly about your professional background.
Okay. So, I was born, in the northern of Iraq, the Kurdistan region. And then I finished my medical school in Mosul in 1983. I came to the United States, in 1997. I arrived the mainland. And then I did my USMLE, and then the residency again. And I'm working since 2003, actually, as a primary care until now.
And where is your practice located?
Now I'm in Laurel. I did before in multiple regions, and then Montgomery and also in PG. But now recently I'm working in Laurel region, city of Laurel, Prince George's County.
Having collaborated many times over decades, my friend, I know that when I speak to your patients, you being the internal medicine specialist and I being a gastroenterologist, they all rave about your heartfelt bedside manner, and they even say that without exception, every time you knock on an exam room door, the first thing you say to them is, "How are you, my friend?" And you really mean it.
Yes, I mean it. The majority of my patients, they are with me actually over the last 20 years, So I feel, they are my family members, so they are my brothers, sisters, and friends, And I believe that, that relationship give me a strength, to work and to continue working. I'm an old man now, but I'm still working because of that relationship with my patient.
Very nice. So let's then go back to the beginning of your career. Why did you choose to become a physician as opposed to other professions?
Yeah. Actually, it was the desire of my father, When I started the high school, he came to my room and he told me, "Son, we have engineers and teachers in our family and we don't have any physician. You have to become a physician." So actually I listened to him and I studied very hard. I, attended the medical school and then I became physician because of him,
So, looking back over the span of the years, the decades, are you pleased with your decision?
Yes. Actually, I'm very happy with my decision, And I believe the field of medicine is a rewarding field, And it's a wonderful field,
Now, you do internal medicine.
Yes.
Why this specialty as opposed to other specialties?
So, in Iraq, when you start the residency, usually the resident rotate in the surgical and medical wards, and then subspecialties also. So I did actually surgeries and medicine, and then subspecialty ENT and ophthalmology also. But I found, the internal medicine is more attractive to me, appealing to me. That's the reason I choose the internal medicine.
Once you emigrated to the USA, how did you attain recertification?
Yeah, so it really was not easy, I came 1997, so I have, at that time I had 4 kids also with me, so I was working and studying, at the same time. But I did my USMLE and then I did also the residency. And then I got my board also in internal medicine.
Describe a typical workday. You arrive at the office what time?
So usually I arrive, 10 minutes before we start. I usually start now at 8 o'clock, And then I see patient from 8 o'clock until 4:30. After 4:30, I stay also 1 hour or 2 hours, in the office, finishing my notes, responding to the patient's messages, calling the patients about their labs, and imaging results, And then I go home after that.
Do you take a midday break?
Yeah, I take, half an hour.
Half an hour.
Right.
So what time do you typically get home?
So around, usually 7 o'clock.
Okay.
About
so
7 o'clock.
so about an 11 to 12 hour day.
Yes, I do.
And how many days a week do you work?
5 days a week.
Okay. Do you have to do any work on weekends?
Very little.
Yeah.
Yeah.
I, for many years, had to go on every Sunday to do my consultation letters because there was no time during the week,
Right.
including my letters
I
for
see
you.
sometime on these Sundays, yes.
Yeah. So what sort of patients do you see?
Yeah, really I see the majority of my patients, they are geriatric, but I see also a young adult and the middle ages, but the majority of them, geriatrics with chronic diseases, So I manage the chronic diseases.
Now, you mentioned earlier how close you are with the patients.
Right.
How do you view these patient relationships?
Yeah, so it's rewarding, as I mentioned. I feel they are part of my family, as I mentioned also. So I'm very happy with them,
And what sort of common mistake or misunderstanding do you see patients making?
Yeah, sometimes, the patient thinks when they control their diabetes, for example, or hypertension, that is done, they stop their medications,
Oh my.
So I tell them this is diabetes is a progressive disease, You have to continue your medication, that's important, in addition to the lifestyle changes, which is cornerstone, of the management, but you still need sometimes medication to be able to control, achieve your goals. So that's my problem sometimes with my patient.
Have you found that these new GLP-1 agonists have transformed your management of diabetics?
No question. Now we are managing diabetes in much better way than before. When I started 40 years ago, it's much different now. We are better understanding of diabetes. We have better, tools to manage the diabetes. So yes,
Yeah.
it's really those medications, they are wonderful.
And of course, the weight loss is a big help.
Weight loss and also heart protection, kidney protection. They have a lot of benefit.
Yeah. So what do you find most rewarding as a physician?
Anytime I see my patient achieve their goals, that's my best reward, really. I feel very happy, and I tell myself, this gentleman or the lady made my day today.
Ah, very nice.
Yeah.
Now, all of our colleagues, including you and I, have reflected on the growing challenges of providing health care for patients.
Right.
What do you find to be your primary frustrations, challenges at this point?
Sometimes I see the patient, they have some mistrust, physician, mistrust in the system. So that sometimes is a challenging, for us. But usually I tell them, let us work as a team, and then also, let us make a shared decision, But you have to trust me to be able to help you. The other issue also we have with the prior authorization, sometimes we have problem with the prior authorization when you prescribe medication and then the insurances, health insurance, they deny that, It's also a challenge, So you have to choose some other medication which may be not effective, as the one we prescribed at the beginning.
Do you spend a lot of time writing letters of appeal or making phone calls to insurance companies?
So we do. We have prior authorization now. Fortunately, it's electronic now, so it's much easier now. We tell them, but there is no guarantee they will approve it, There is no guarantee.
Sure. So a challenge for all physicians is work-life balance.
Right.
So how do you balance your professional life and personal life?
So I have to admit it's sometimes very difficult, to make such balance, If you want to become a successful, physician, you have to commit yourself and your time for your patient, And that definitely affects your time, you can't spend a lot of time with your own family members. But usually Saturday, Sunday, I stay with the kids, we watch TV together, especially sports, they love sports,
Sure.
So we do together, Sometimes we visit friends, family members around this region, also. And then I take, every couple months, 2-3 months, I take 1 week vacation, just stay with the kids, at home, just to stay home, So that's what I do also.
How many children do you
I
have?
have 5 kids.
And what are their genders?
So 3 boys and 2 daughters.
And how old are they?
The oldest one is 35 and the youngest is 18.
And did any of them go into healthcare?
None of them. Yeah.
Had you encouraged or discouraged?
Actually, I encouraged my daughter, but she chose the bioengineering.
Okay.
So she went from pre-med to bioengineering.
Right.
So she got her master's degree a couple of days ago, from bioengineering, and they offer her also a PhD on the scholarship,
Wow.
Yeah.
Should be very proud.
Bioengineering. I'm proud of her.
Very nice.
Right.
So,
The others are IT, and engineers.
okay, all very bright,
Yeah.
accomplished. Wonderful, wonderful. Now, one thing that challenged the country in general and the medical profession in particular was the COVID-19 pandemic.
Right.
What sort of challenges did you face with your practice during the pandemic?
Yeah. So no question at that time, the pandemic paralyzed our clinic. First couple, 2-3 months, they really were paralyzed, But thankfully, the telemedicine opened the door again, for us to reconnect with our patient, And that's what we did, Nowadays we, are able to catch up, of course, But at that time, a lot of patients, they were not able to do their procedures. They were behind, like colonoscopies, like their mammogram or DEXA scan. But now they catch up. Now we are okay. We are in good shape now.
Did you find it a hardship for your staff and you to wear personal protective equipment?
Actually, at that time, we have everything, available for us.
Sure.
So our company did a good job, in offering all those protective gears, for us.
Now, you mentioned telemedicine. You found it productive use of your time?
I believe it's a very, very nice tool, a wonderful tool. Another venue, in managing the diseases, and managing problems of the patient, And I believe Zooming is very effective way, to manage a lot of problems. The patient, they don't need to come every time, to see me in person, I believe it's a wonderful tool,
I agree.
Yeah.
We're going to pause briefly for a public service announcement. More with my guest, Dr. Mahmoud Doski, in a moment. We're discussing the challenges of primary care medicine in today's day and age. We'll be right back. We're back. My guest this evening is Dr. Mahmoud Doski, a noted primary care physician here in Maryland. Mahmoud, when we paused for the break, I wanted to bring up another important topic. Given how busy we are with patient care, How do you stay current with the medical information out there?
So, as you know, Dr. Doman, the internal medicine is a dynamic science, and it changes, We have a lot of studies going on, so it changes actually. The concept usually change every 4 or 5 years, So now I feel American College of Physicians, they have a very good tool, MMCTV, which is the medical knowledge, self-assessment program. It's a very nice tool to update yourself, in the field of medicine. Also, a lot of universities, they have life programs, courses for the continual medical education, So I love to do it with them, and now become much easier, with the Zooming. So I don't need to travel to Boston, to attend the course for the Harvard Medical School. Now I do it from my home, So really I do this, both of them, the MMCTV and then the those courses, I love to do both of them.
Sure. And I presume you also read the Annals of Internal Medicine.
Yeah, we have also, I give that also.
Sure.
Yeah.
Excuse me. So how have you seen internal medicine as a specialty change over the years?
Yeah, so we have much better, tools now, to deal with those, with a lot of medical problems. Before we were very limited, Now we are much better. We have much better tool to manage, to discover. So actually we are in better shape now,
You have an electronic medical record in your office?
Yes.
So all of us as physicians are challenged when we need to embrace new technology, especially during busy office hours. But have you found it to be a net plus?
Yeah, it has plus and it has minus also, For us, because I dictate, so it takes time, for me. But it's a good tool also because everything is there, If you need something right away, within a second you can access the chart, and you see what's happening.
Sure.
So that's a good, that's plus, But for us, we have to dictate, and that takes time.
Right.
Yeah.
So how do you handle difficult and non-compliant patients?
Yeah. So that is sometimes challenging, as I mentioned, But usually I tell them, show it to them the consequences of the non-compliance, If he has hypertension, uncontrolled, I tell them, you are at risk of heart disease, heart attack, stroke. So I try to tell them, to make them aware of the problems if they don't control their medical problems,
And are you finding that for your loyal patient population, they're pretty compliant?
Yes.
Yeah.
Yes.
I would
The
think
majority
so.
of them, really, for me, I feel more than 90% of my patients, they are compliant.
Very good.
Yeah.
Very good. So as you know, besides my doing clinical care for decades, I also am a clinical professor of medicine at George Washington University in gastroenterology. Have you, my friend, considered doing any teaching or working in the hospitals?
So not now, I did while back home, I taught in my city, the Hawk Medical School, for 2 years I taught them community medicine. But here, not really, I'm not, because I'm planning to go part-time, and then I believe it's time for me after that to retire.
Sure. And in anticipation of retirement then, what sort of hobbies do you have when you're not caring for patients?
Yeah, so I read history, I love history. Also, I love to travel, and hopefully I will have time, in the retirement, to visit all those cities and historical regions,
Sure.
in Europe, in Africa, in Asia, Hopefully I will be able to see them,
Absolutely, absolutely. And do you like to read novels or mostly historical?
Just history, more history.
Sure,
right,
sure. So, given the span of your career over so many decades, what advice would you give to young, aspiring physicians?
So I always, tell the new physicians, please listen to the patient more than talking, Be patient and listen, and then you will be rewarded.
Yes. And I often tell young physicians, when you walk into an exam room, sit down, because if you're going to speak to the patient standing, or even worse, you're talking with them with a hand on the doorknob, that's telling them that you're in a rush.
Right.
So sit down. That's bedside manner 101.
No question. That's the most important thing. That's the way you get the trust of the patient.
Yeah. And also, it's important, as you said, I agree. I think the number one thing we do is listen. Very, very important. What general advice would you give to the American population? Because they're at times different than, for example, the European population.
That's right. So I tell them, that please exercise, please eat healthy, please do all your the preventive measures, and procedures like, vaccination, procedure like colonoscopy, mammogram, pelvic exam, DEXA scan. And if you are above 40, 50 years old, I believe it's worth it also to do your blood work once a year or every 2 years. It's really important. I see sometimes patients, they didn't see a physician for 10 years. I believe that's too much. They need to do better.
Sure. I think one thing that's so interesting in terms of preventative care in internal medicine is the recognition in people that are chronic smokers to do annual CT scans.
Yeah.
Please explain that to the viewers.
Yeah, we are doing it now, for patients who are smoker or they have, less than 15 years they stopped, the smoking, and they are, 50 years old or older, We do the CT chest every year, a low dose CT.
And what is the CT scan screening for?
For the lung cancer.
Right.
Yeah, for the lung cancer.
And what is the preliminary data of the value of the scan? Are you finding earlier lesions?
So we see the nodules, So the nodules, we go after the nodules every year, and then I send them also to a pulmonologist anytime they have a nodule, especially the big nodules, I send them to the pulmonologist so they can take over,
And is it your sense that people are actually preemptively being cured of the cancer because being picked up so early?
So really, I didn't have anyone in my practice, For myself, I didn't see anybody, until now.
Okay.
Yeah, but most likely there will be benefit,
Sure,
Yeah.
sure. And what is the compliance that you're getting for things like mammography and pap smears? Is it good?
It is good, Now people, they understand, the situation better. So actually they are doing it,
Sure.
Yeah, so really good compliance.
And how about your experience when you recommend colonoscopy for colon cancer screening?
So the majority of the patients, they accept that. Some of them, they are reluctant, for whatever reason.
Sure.
So those people, I tell them, do the Cologuard.
Perfectly reasonable, yeah. It's better than, any screen is better than no screen.
Right.
Yeah, absolutely. What are your thoughts about ischemic heart disease? Is any sort of screening appropriate at a certain age?
So at age 40, I do for everybody EKG, And then if they have family history, really, I send them to the cardiologist.
Very good.
And then I looked also at their, cholesterol profile and their risk factors, also. If they have multiple risk factors, I send them for stress tests,
Mm-hmm. Yeah. At what point do you treat somebody's cholesterol with a statin?
So it depends on their risk factors and their age, also. So, but if the LDL is above 190 or above, that's the guidelines, Even if they are young, I put them on the statin. And the other people, I look to their, 10-year risk of having atherosclerotic cardiovascular disease. So if it is more than 10%, I usually put them on the statin also.
It's been a dramatic change in the convenience of safety of the anticoagulants, hasn't it?
Yes.
Instead of using Coumadin, warfarin,
Yes.
now more and more in primary care using agents like Eliquis.
Right.
Share with the viewers
Yeah.
the difference.
So the Eliquis really is much safer, you know, and also much easier, because the Coumadin you have to, you know, do the PTINR every couple of weeks, you know, and then you have to
blood
adjust
test.
the medication or blood test, right, you know. And then you have to adjust the medication also up and down. While the Eliquis, Pradaxa, and Xarelto, you don't need, you know, such adjustment. You know, you take it and forget it. Forget about it.
So you don't need blood tests for those medicines?
No need for
Yeah.
that.
And my understanding is the risk of bleeding is quite a bit
It's
less.
actually is less than Coumadin.
Yeah. And I believe the incidence of drug interactions is also quite low.
It's very low.
Yeah.
Right.
So that's really been a dramatic change in
It
what
was
you've
a
been
blessing, you know, for a lot of people. Yeah.
doing. How about arthritis? You see patients with
Yeah,
arthritis?
so because I see geriatric,
Right.
you know, I have a lot of
So
arthritis.
what have been the changes there with treatment?
So really, you know, they're giving them the injection, you know, steroids, sometimes this, you know, some other injection also for the knees. But, you know, if they are, you know, overweight, we tell them, you know, lose weight, and that really help, you know.
Yeah,
And then, you know, usually I send them also to the orthopedist,
sure.
you know, so they can deal with. But really, there is nothing, you know, dramatic about the arthritis, you know.
Have you at all been sending patients for monoclonal antibody, biologics, for rheumatoid arthritis or anything like that?
So we do rheumatoid factor, and then the anti-CCP also, we have that. We usually do those two tests, you know, for people with the, and then ANA also for the lupus, you know. Yes, we do that also. If we feel, you know, the patient has evidence of rheumatoid arthritis or lupus, you know. But most of them, they have just osteoarthritis, you know.
Yeah, wear and tear arthritis. Yeah. Sure. And have you, over the years, seen any changes in treatment of things like migraine?
Migraine, we have new tools now, you know, actually. Yeah, it's much better than before, yes, you know. You know, now we have more tools coming, you know. Yes.
Can you share some of those tools or treatment options with the viewer?
We use the preventive now, you know, for beta blocker, and also now they have the new triptan also coming,
Right.
you know, also.
Very nice. And then, of course, there's also dietary recommendations you can make.
So dietary, they have lifestyle changes also, you know.
Sure,
Yeah,
sure.
no question about that.
Well, if our viewers have any questions, how can they reach you?
So they can call me anytime, you know. I can tell them to call my office, 301-725-5652.
Very good.
Yeah.
Well, Mahmoud, it's been a delight to speak
Thank
and
you.
reflect on your career, and in some respects mine at the same time.
Thank you very much, Dr. Doman, for having me today.
And thank you. What you do is a valued community resource.
Thank you.
My thanks to Dr. Doski for an excellent interview. My thanks to my team here at the studio for making this program happen. And finally, thanks to you, the viewer, for joining us this evening. If you have any suggestions, you can reach me at my email address at the bottom of this screen. As for our next show, I'll have Dr. Bradley Kleiman, a noted Montgomery County gynecologist, as my guest. Brad and I will be discussing a very important topic: latest research and treatment options for menopause. See you then next time for another edition of Housecall. Good evening.